James Brown is a familiar face at Rapides Regional Medical Center. For more than a quarter century, he's been the Adams Pest Control representative for the hospital. One place at Rapides Regional Medical Center Brown had never visited was the heart cath lab, but that all changed in late September.
Well, prior to September the 30th, which is a date that I'll always remember, about a week before that I had increasing what I thought was indigestion, and had even cut wood one day and seemed to be quite out of breath, tired, something that's not normal for me. And even Wednesday night, the night of the 30th at church, I was joking with my church family that I either was having a heart attack or bad indigestion, and it turned out to be the heart attack. Went to bed that night, woke up with severe pain in my chest, radiating down into my left arm, and I knew it was not normal. It was something pretty bad, and so we called 911 in the ambulance at that time. And the ambulance, the EMT got there, checked my blood pressure, and it was like 250 over 150. The ambulance got there, started assessing me, ended up giving me nitroglycerin to relieve the pain, and then they transported me to a hospital, and en route they asked me which hospital, and I said Rapides. I know everybody there. And so I wanted to go where I knew people.
Brown's family had a history of heart disease, but he had never had any major issues aside from high blood pressure. Cardiologist Qusai Saleh ran tests before doing a heart cath.
After being assessed at the emergency room at Rapides Hospital, the initial EKGs and the blood enzymes didn't show a lot. But through my report of what had happened, they admitted me and assigned Dr. Saleh as my cardiologist, and he ran a battery of tests and initially didn't show much, but he saw enough to decide that I needed a heart cath. And then he proceeded to do a heart cath on November the 2nd. And he did find what they told me was the widowmaker. I had a 90 and a 75% blockage in my LAD, and he was able to clean them out, balloon them, and stent them. And at the end of the surgery, he told me that I actually had a new LAD and should be in good shape.
A widowmaker refers to blockage in the left anterior descending artery. The LAD is the largest of the three arteries providing blood to the heart. Dr. Saleh cleaned the arteries and inserted stents. Because Mr. Brown did not need open heart surgery, he was able to keep a very important engagement, the October 24th wedding of his daughter Shauna to Jacob Timothy.
I am doing wonderful today. I'm getting my strength back. My wind is back. I am doing things that years ago I would do and didn't know I was out of breath and tired on, and now I'm not. I feel wonderful. And I do have a new lease on life. I do have new energy. I am on medications that I'm getting acclimated to, and that's going fantastic. I just have a new lease on life. I'm blessed. After I was actually admitted to Rapides Hospital and put on the 3rd floor, my wife had gone home to get some things ready for the next few days, and I was by myself, and I was sitting on the couch, and I got quite emotional. And Kayla came in, the nurse, and she realized what was going on, and she walked over to me, and she put her hand on my shoulder, and she said, "Mr. Brown, we're going to take great care of you. It's going to be okay." And it was. And I will say this, I've taken pride for years in the job that I do here at Rapides Hospital and taking care of Rapides Hospital. And when I needed Rapides Hospital to take care of me, they absolutely did.
For more information on heart care on a higher level, visit rapidesregional.com.